Bob Casey, a Democrat from Pennsylvania, a man who will have some say in the new way forward for health care reform. Senator Casey, thank you so much for being with us. You may have heard my conversation with Garrett. The Republicans have now tried this a few ways. It seems to be a mathematics problem. The idea that you're a Republican doesn't mean you share an agreement on how repealing Obamacare comes about. So at this point, it looks like the party that governs in the Senate and the House is going to have to reach out to Democrats and find some alternative.
Well, Ali, the good news is that not only will this bill not be considered this week, a very bad bill, especially with regard to Medicaid, but the good news is, Ali, that's already happened. Democrats and Republicans have worked together for weeks on this stabilization bill that Republican leadership just kicked down the stairs last week. They should immediately commit to passing that stabilization bill and getting the children's health insurance reauthorization done. We could end this week on a very high note, a bipartisan note on health care. Children's health insurance, stabilization, give some certainty to the markets, and then try to move to other issues where we can work together instead of this partisan ideological bill that they were pushing for the last number of days. So we could end this week on a very high note if they're willing to do the right thing in a bipartisan fashion. Support Lamar Alexander and Patty Murray's work.
Unfortunately, the insurance companies, and this affects everybody who has some form of insurance, whether you're on the public market or you are employer covered, they've got to submit their insurance rates this week for open enrollment, which is going to be a shorter period this time than before, certainly for people on the open market. But the bottom line is it's going to come too late. So what we are going to see is higher premiums next year from the insurance companies, who are protectively going to increase premiums in case the administration stops those cost-sharing reduction subsidies. And the president and others are going to go out and say, see, Obamacare's not working. Your rates are going up again.
Well, Ali, there's no question that the administration has sabotaged on a number of things. Limiting dollars for advertising, basically telling people don't sign up for health care, and sabotaging it in other ways by creating doubts about the cost-sharing reduction payments. The good news, though, is cost-sharing reduction payments are bipartisan. And we could have a bill passed this week if Leader McConnell said, we want to vote on that tomorrow or even later today. Get that done and create some certainty out there, not only for insurance companies, but for people that have to rely upon insurance every day of the week. So there are some things that the Republicans could help us with right away to give assurances on health care.
Senator, what do you think about Bernie Sanders inviting 200 million of your closest friends into health care? This idea of Medicare for all, which is essentially a single-payer system on steroids, has got the support of a good number of your Democratic colleagues. It's something the Republicans have really latched onto as a campaign, that if you don't support our repeal, you're going to end up with single-payer health care. What do you think of single-payer health care and Bernie Sanders' proposal?
First of all, I'm not interested in lectures from Republicans about health care. They haven't spent a lot of time on it. You can tell they haven't. But here's the deal. We're going to have a lot of ideas about health care. Lots of bills, lots of ideas. That's good. But we have to subject every idea to a lot of hearings, a lot of scrutiny. We can't say that the Republican bill didn't have enough hearings and then march forward with new ideas. We've got to take these ideas one at a time. The most important thing we should do for the next couple of days on health care would be pass the children's health insurance program and then also pass the stabilization bill. They're the two most important things we have to do right now. Next week, the week after that, we can have, and we should have, weeks and months of hearings on a lot of good ideas. Democrats have ideas on a whole range of things. Buying into Medicare starting at age 55, expanding Medicaid even further to bring more people in, to cover more people. There are a lot of ideas. We need months of hearings on a lot of good ideas, and I'm sure people in both parties would appreciate that, instead of having the collision we've had where one party has been obsessed, the Republican Party, with decimating Medicaid, not tweaking it, decimating the program that helps our kids, people with disabilities, and seniors.
Senator, good to talk to you as always. Thank you for joining us. Senator Bob Casey, Democrat from Pennsylvania.